Burnout among doctors could cause a shortage of physicians by 2034. That's according to the Association of American Medical Colleges. The U.S. Surgeon General, Dr. Vivek Murthy, warns that doctors have been pushed past their breaking point due to COVID-19. He says that the pandemic has been a, quote, uniquely traumatic experience for the health workforce and for their families. For more, I want to bring in Dr. Tina Shah. She is a clinical care physician and a former senior advisor to the U.S. Surgeon General. She also co-chairs the National Burnout Symposium Conference. Dr. Shah, thank you so much for being here to talk about this important subject. So COVID-19 is just one of many reasons why American doctors have been experiencing burnout. Tell us, what are some of the other factors?
This is such an important question. In fact, we've been dealing with burnout for decades, even before the pandemic. And really, burnout is because of poor design of our workplace, from inefficient technology that we use, like the electronic medical record, to spending a lot of time doing extra documentation, not for our patients, but for billing, and even having to deal with cultural problems in the workplace that make it unsafe and make it hard for us to do our jobs.
On that front, a recent survey by the University of Colorado School of Medicine found nearly 20% of physicians reported experiencing discrimination and mistreatment because of their race, ethnic attributes, or gender by patients, by families. Tell us, what is your take on this? How has it contributed to burnout?
I think it's contributed to burnout in a very massive way. And I'm so glad that this study came out, because we don't talk enough about what it's really like on the front lines. And the truth is, just like we deal with racism in other parts of the US or discrimination for different reasons, we deal with that in our hospitals and our clinics as well. But this time it has a much larger public impact in that when physicians are experiencing discrimination, this is directly linked to burnout. And when we are burnt out, we know that burnout leads to folks decreasing the number of hours that they spend working as doctors, and sometimes even leaving the workforce. And so as we're still in this pandemic and we move further out and we think about what life will be post-pandemic, we need to have people there to take care of us when we need help. And right now we're really at a very high threat level with not having enough physicians, nurses, and other healthcare professionals.
So you say a high threat level. Tell us, how concerned are you about this projected shortage of doctors in the U.S., and do you think that it can be prevented?
I am extremely concerned, and I think you had mentioned the American Association of Medical Colleges estimates that up to 140,000 doctors is the gap that we will experience by 2033. But I will tell you, in many places in our country, especially in our rural areas, we already don't have enough doctors, don't have enough nurses, and especially with COVID, don't have enough respiratory therapists. So we're already experiencing this problem while we're in the pandemic. If we don't take care of this now and redesign how our workplaces are and make it easier for our doctors and other clinicians to do their jobs, we simply won't have enough people to take care of everyone that lives in our country when they get sick.
An important conversation, one that we need to keep going. Dr. Tina Shah, thank you.